Today we're going to talk about inflammatory bowel disease. Yesterday we talked about if when autoimmune disorder happens in the knees and why people usually have bad knees because of autoimmune disorders. This time we're going to talk about if it happens in the digestive system. What if this autoimmune disorder, what if the damaged cells, the autoimmune damaged cells in the digestive system, what are the complications that are going to happen, what causes it in the first place, and so on and so forth. Next slide. Okay, so in the term inflammatory bowel disease, it's a general term for as the name implies, inflammation in the bowel, which is basically your digestive system. Group of disorders in which the intestines become inflamed. It has often been thought of as an autoimmune disease, but research suggests that the chronic inflammation may not be due to the immune system attacking the body itself. So it can have more than one cause. It's not always autoimmune, but we try to focus on autoimmune disorders, disease. It could be a result of the immune system attacking a harmless virus, bacteria, or food in the gut. So basically, there are helpful or harmless, let's say, is the better use to say, it's more general, virus and bacteria, and that the immune system shouldn't declare them as antigens, but it does, and that could be also a reason. And it might attack also food that you need in the gut, and that can also cause inflammation, at least to bowel injury. Next slide. There's two main types of inflammatory bowel disease. There's ulcerative colitis, which is mainly in the large intestines or the colon. And there's Crohn's disease, which is basically the whole digestive system, the gastrointestinal tract from the mouth to the anus. So it's the specific one that happens in the largest intestines is called ulcerative colitis, and the one that happens to any part of the gastrointestinal tract is called Crohn's disease. But the most commonly, it affects the last part of the small intestines or the colon or both. So there's tendencies. Next slide. Okay, what causes IBD? What causes inflammatory bowel disease? And if it has an unknown cause, we don't know the exact cause of it. There's no way we could tell, but there's some agents or like combination of agents, such as bacteria, viruses, antigens. They can trigger the body's immune system to produce an inflammatory reaction in the intestine. Recent studies show some combinations of hereditary, genetic, and or environmental factors may cause the development of IBD. So, as of other autoimmune disorders, the main triggers, the main combination is genetics, in which like you're more prone, you're more susceptible to such disease, and environmental factors that trigger this disease. Usually what happens is if one of your cells get damaged, the immune system declares the DNA of the damaged cells as dangerous and causes an antigen and attacks the rest of the cells. It could also be that the body's own tissue causes an autoimmune response. Whatever causes it, the reaction continues without control and damages the intestinal walls, leading to diarrhea and abdominal pain. Yeah, so just the own immune system attacks the tissue of the intestines, and that's what causes so much pain, so much damage. Next slide. What are the symptoms? How do you feel this IBD, and it's a chronic disease, and Mr. Natsman, I think, talked about this yesterday, in which like once a week, I think he said, in which he feels pain. It's just periods in which the disease flares up and causes symptoms. Just periods in which the symptoms increase, and then periods where the symptoms decrease, followed by periods in which the symptoms decrease. Yes, I said this. Symptoms range from mild to severe, and it depends on which part of the system is damaged. Like having a IBD in the small intestine is different from the large intestine, so on. And the symptoms differ from place to place and differ in severity. It could be mild, it could be severe. Yeah, just good to know that it's periods. There's periods when you go through a lot of pain, and then periods where you go to a little amount of pain. Next slide. These symptoms include abdominal cramps and pain. Just your stomach legit hurts. Diarrhea that may be bloody, and which could be really dangerous, because we talked about this in the first term. If you lose a lot of blood, it can trigger anemia, and you could have bad anemia and not enough blood cells in your system, and that could lead to a whole another chapter of complications. Severe urgency to have bowel movement, fever. Basically, your immune system is working, and if your immune system is working, naturally you will have some symptoms such as fever. Weight loss. That's mainly due to the fact that your digestive system is not working properly. There's an inflammation, and you lose your sense of appetite. You don't want to eat, and you end up having an extreme weight loss. And iron deficiency anemia due to blood loss. I just talked about this. If you lose a lot of blood during diarrhea, that could lead to a whole nother chapter of blood complications. Yeah. Next slide. IBD can lead to several serious complications in the intestine. So what's the worst thing that can happen? What if you have this disease? What will happen further on? One thing is profuse intestinal bleeding from the ulcers. You might have ulcers that cause a lot of bleeding, and we already talked about the bleeding, the complications that could happen. Perforation or rupture of the bowel. Maybe like rupture in the bowel means like your intestines has a hole in it. Narrowing, called a stricture, and obstruction of the bowel, found in mainly in Crohn's disease. Fistulae, abnormal passages, and perineal disease, disease in the tissue around the anus. These conditions are more common in Crohn's than in ulcerative, basically because Crohn's is basically the whole digestive system. Yeah, it's just some damage near the anus. Toxic megacolon, which is an extreme dilation of the colon that is life-threatening. It's associated more with ulcerative colitis than Crohn's, because ulcerative colitis is in the colons or the large intestines. And malnutrition. I think that's pretty self-explanatory. And these are the things that could happen if you get the inflammatory bowel disease gets out of hand, becomes severe. Next slide. What puts you at risk of having IBD, inflammatory bowel disease? One thing is age. Most people who develop IBD are diagnosed when they're 30 years old, but some people don't develop the disease until their 50s and 60s. So basically, mainly old people get. That's why, like in this COVID pandemic, the main people that were concerned that people were concerned of getting COVID were older people, because there's a big problem in their immune system, and this is one of the things that can happen if you have a bad immune system. And That's why it's probably more common in older people than in younger people. Race or ethnicity, although whites have the highest risk of the disease, it can occur to any race. I think that's just basically statistical. There's no actual proof to it. Family history. As we said before in the causes, genetics does play a role. You're more susceptible if you have bad genes. So having a, say, parent who has it, you are at risk of also developing it because you are more susceptible. And cigarette smoking. Cigarette smoking is the most important controllable risk factor for developing Crohn's disease. So what happens is, like, let's say a cell, because of smoking, a cell in the large intestine gets damaged, and if the cell gets damaged from an outside cause, from environmental factor, it becomes an antigen because it's foreign cell, like it's something that's not supposed to be there, and then your immune system sees it, and it declares that your DNA is this DNA of this unknown object in the digestive system is an antigen. It's a foreign subject that should be removed. So it declares anything with this type of DNA needs to be removed, and it ends up attacking your healthy cells because they have that DNA. And yeah, that's how smoking could really hurt, because it's basically foreign damage. Non-steroidal anti-inflammatory medication. There's some medication that needs to be looked out for because of the side effects, and can cause IBD. Next slide. Diagnosis. It's a bit long. I'm going to talk about a couple of them. Hopefully I'll just summarize them and make them simple. Your doctor may take a diagnosis of inflammatory disease based on your symptoms and various exams and tests. The first thing that they might do is having a stool exam, which is basically taking a look at your feces, giving them a feces sample, and they look out for some things that may indicate you have IBD. And they look for first of all, they look for the possibility of a bacterial, viral, or parasitic cause of diarrhea. I think I've had one time where I had to do this, and I think I did have IBD, but I'm not sure. And the stool will also examine the trace of blood that cannot be seen with the naked eye. I think I did have IBD, actually. Thinking about it, once I did have a test, and there was like a lot of viruses, and also blood was detected in my feces. So I think I may have had that before. A blood test. They can have a blood test and see if there is any signs of inflammation. Well, basically, they take a sample of your blood. You know how that works. An increase in the white blood cells count suggests the presence of inflammation. We know that the white blood cells are basically they are the immune system, and if there's a huge presence of them, it may indicate there's inflammation and that something needs to be done. And another thing is, if you are losing a lot of blood and you don't know it, and they actually do a blood test, they can see the amount of blood that's going through. And if there's a decrease in blood, that means that you're bleeding. And that may also indicate that there's an inflammation and that things need to be done. There's other blood tests that they look for, of basically any sign that indicates that you have an inflammation. It's a lot. I don't think we need to go through the specifics. Yeah, just blood tests and feces. Next slide. They might take an X-ray. There's the barium X-ray, although seldom used. It can check the upper gastrointestinal tract, the esophagus, stomach, and the small intestines. It's mainly for Crohn's disease. They look for abnormalities caused by Crohn's disease. You swallow chalky white solution that coats the intestinal tract so it will become visible on x-rays. If a barium study is used to track the lower gastrointestinal tract, they'll be given an anemia containing barium and used to hold it in while x-rays are taken of the rectum and colon. Abnormalities caused by either Crohn's or ulcerative colitis may show up in these x-rays. So basically they have a white chalky solution that is visible through the x-rays, and they make you swallow it. And then what they and what they do is they check it through the x-ray and check for any abnormalities because of this. There's also other radiologic tests that can be done. Ultrasound, MRIs, CT scans, just diagnose Crohn's disease and ulcerative colitis. Next slide. There's also another test in which they use a microscope, and they may put it through the mouth. They checks the upper GI symptoms, such as nausea and vomiting, the gastrointestinal system. A doctor will use an endoscope, a narrow flexible tube with a camera and light. This will be inserted through the mouth to examine your esophagus, stomach, and duodenum, which is the first part of your small intestine. Ulceration occurs in the stomach. Okay, so basically, what they do is they have this endoscope, which is flexible tube that has a camera at the end of it, and they place it in your mouth and they look inside your digestive system, your gastrointestinal tract, and they check for anything. There's also another one where they put it inside another place to check the lower, the large intestines and the lower part of the gastrointestinal system. Capsule endoscopy. This test may be helpful to diagnose disease in the small intestines, such as in Crohn's disease. You swallow a small capsule that has a camera in it. Pictures are taken of basically just put a small camera. They just swallow a small camera. And they just take pictures inside your small intestines. And yeah, which is kind of weird and cool at the same time. And the camera is passed through your body into the toilet. So basically swallow a small camera and it just checks inside the inside of your digestive system. Next slide.
The goal of inflammatory bowel disease treatment is to reduce the inflammation that triggers your signs and symptoms. In the best cases, this may lead not only to symptom relief but also to long-term remission and reduced risk of complications. IBD treatments usually involves either drug therapy or surgery. One of the drug therapies is anti-inflammatory drugs. They are often the first step in the treatment of inflammatory bowel disease. Anti-inflammatories include corticosteroids and aminosalicylates such as mesalamine, balsalcide, and alsalcine. Which medication you take depends on the area of your colon that's affected. Another drug therapy is immune system suppressions. These drugs work in a variety of ways to suppress the immune system. The immune response that release inflammation reducing chemicals into the body. When released, these chemicals can damage the lining of the digestive tract. Some examples of immunosuppressant drugs include azathioprine, mercaptopurine, and methotrexate. Then we transfer to therapy. If diet and lifestyle changes, drug therapy, or other treatments can't relieve your IBD signs and symptoms, your doctor may recommend surgery. Surgery involves removal of the entire colon and rectum and the production of an internal pouch attached to the anus that allows bowel movements without a bag. In some cases, a pouch is not possible instead. Surgeons create a permanent opening in your abdomen through which stool is passed for collection in an attached bag. Home remedies for ulcerative colitis, because we talked about surgery for ulcerative colitis when they attach the bag. And symptoms, home remedies, avoid spicy foods, alcohol, and caffeine. Try fish high in omega-3 fatty acids, restrict fiber, limit dairy products, and eat small, more frequent meals to digest better and more efficiently. Now, surgery for Crohn's disease. Up to two-thirds of people with Crohn's disease will require at least one surgery in their lifetime. However, surgery does not cure Crohn's disease. During surgery, your surgeon removes the damaged portion of your digestive tract and then reconnects the healthy sections. Surgery may also be used to close fistulas and drain abscesses. The benefits of surgery for Crohn's disease are usually temporary. The disease often recurs frequently near the reconnected tissue. The best approach is to follow surgery with medication to minimize the risk of recurrence. Sometimes you may feel helpless when facing inflammatory bowel disease, but changes in your diet and lifestyle may help control your symptoms and lengthen the time between flare-ups, such as diet, stress removals, and quitting smoking. And here's the end of the presentation. Thanks for your attention.